Localization of an accessory pathway relies on analyzing the initial 20 to 40 milliseconds of the QRS complex, the delta wave. Because this initial deflection represents purely pre-excited myocardium before normal His-Purkinje system catches up, the vector of the delta wave points directly away from the pathway's ventricular insertion site. Lead V1 sits to the right and anteriorly. It is the primary discriminator for which side of the heart holds the pathway. Positive delta R more than S in V1 is classically left-sided, old type A pathway, and the vector direction is travels anteriorly and rightward towards V1. Negative delta, that means QS or tiny r with deep S in V1, it's a classic type B or right-sided pathway. The vector travels posteriorly and leftward away from V1. Lead 2, 3 and AVF act as the floor of the heart. They determine the pathway's position along the superior-inferior axis. Negative delta in inferior leads, pathway location posterior or posteroseptal. Vector travels superiorly away from the inferior leads. Positive delta, pathway location anterior or anteroseptal. Vector travels inferiorly towards the diaphragmatic surface. Differentiation of a septal insertion from a free wall insertion requires looking at the frontal plane leads 1 and AVL and the precordial transition zone. Left lateral free wall pathway. Look for a negative or isoelectric delta wave in leads 1 and AVL. The impulse is traveling from the far left lateral edge towards the right. Right lateral free wall pathway typically shows a strongly positive delta wave in lead 1. The precordial transition R more than S is delayed, often not occurring until V3 or V4. Septal pathways. These often present with a very early precordial transition V1 or V2. Posteroseptal pathways specifically will often mimic an inferior myocardial infarction, presenting with deep Q waves which are actually negative delta waves in leads 2, 3 and AVF. Accurate localization requires maximal pre-excitation. If the baseline ECG shows minimal pre-excitation due to rapid AV node conduction, the delta wave vector will be blunted or misleading.